Hello, everybody. Welcome to today's webinar, You and Your Body, Cancer, Intimacy, and Sexuality. My name is Sarah Tarani, and I'm the Program Coordinator for Triage Cancer. I'll be moderating today's webinar. Before I turn it on to today's speaker, I just want to go over some housekeeping. All callers will be muted for the duration of the webinar. If you have any questions or technical problems, please type them into the chat box on the side of your screen. This webinar is being recorded and will be available for viewing at the end of the week on our website, triagecancer.org. At the end of the webinar, you'll be redirected to a survey. Please take a few moments to fill this out and let us know what you thought of today's webinar. Now, as part of the accreditation process to give you CEUs, we have to disclose that the planners and presenters of this program have not disclosed any pertinent financial relations or conflicts of interest. This educational program does not have any commercial or non-commercial support other than the support listed from sponsors and partners. Which brings me to the good news that we are now offering CEUs to nurses through the Oncology Nursing Society. This webinar will be good for, if you listen to the entire thing, 1.25 contact hours. So in order to get the CEUs, you will have to be registered online for today's session. So people who are listening in on someone else's computer are not going to be eligible for that credit. You also have to attend the webinar for the entire time to get the maximum number of credits. And within 1 week of this webinar, you have to complete the survey I just referenced. You'll be redirected to it at the conclusion of the webinar. And I'll also send you a reminder to fill that out by Friday. And please note that on this survey, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. The email is the address where we'll send the certificates. And we'll be sending those certificates within 4 to 6 weeks, which feels like a long time, but it will really go by quickly. And if you are listening in on your telephone rather than your computer, please indicate the phone number that you are listening in on that survey. Otherwise, I can't match it up. If you have any questions, feel free to email us at info@triagecancer.org. Now, for those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides information and resources on cancer survivorship issues. We provide this education in a few different ways. First, we host a speakers bureau of experts in all types of cancer survivorship issues available to organizations putting on educational events. You can read about our speaker bios and request a speaker on our website. We also host and participate in events all over the country for patients, survivors, caregivers, advocates, and healthcare professionals. For more information about our signature events, like our Triage Cancer conferences and in-service trainings, please visit our website, triagecancer.org. We have monthly webinars. I see a lot of you returning from last month, so you already know this. Our next one will be on May 24th. It is the Anticipatory Grief and End-of-Life Care, How to Prepare and Care for Life-Changing Events. We also have the full 2017 schedule on our website. So, and I wanted to let you know that on June 21st, that webinar that's coming up, we will be offering free CEUs to social workers as well as nurses. And finally, we have a plethora of resources and tools available for free. For example, we have charts of state laws on employment, disability, and health insurance-related issues. We have quick guides on various topics such as employment, finances, privacy, and clinical trials. These are designed as little snapshots of a particular topic. And lastly, we have an educational blog and e-newsletter where we post late-breaking news about cancer-related legal issues and other happenings in the cancer community. And with that, I would like to introduce you to our distinguished speaker, Barbara Musser. Barbara is an intimacy and sexuality speaker, educator, coach, facilitator, and author. She's worked with thousands of women, couples, and healthcare professionals creating programs to reignite intimacy, sexuality, and relationships after cancer. She herself was diagnosed with breast cancer in 1989. Barbara is Barbara is the founder and CEO of Sexy After Cancer and the author of Sexy After Cancer, Meeting Your Inner Aphrodite on the Breast Cancer Journey. She's a member of the American Association of Sex Educators, Counselors, and Therapists, and the International Society for Study of Women's Sexual Health. With that, welcome, Barbara.
Thank you, Sarah. Hi, everybody. Welcome. I'm going to dive right in because we've got a lot of territory to cover. So today we're going to talk about sex before and after diagnosis and treatment, the emotional impact of diagnosis and treatment, practical tools that you can use now, and how to create a pleasure plan. So I know that we have a mix of healthcare providers and patients on this webinar. So I'm going to gear my talk mostly to patients, but I hope it'll be helpful to you healthcare providers. I'm pretty sure it will. And if you have specific questions, as Sarah said, please type them in the chat box. And I'm going to do my best to get through all this information and then save the questions until the end. So if you have a question, make a note to yourself, and you may find that I answer it as we go along. Let's just dive right in. So what was your sex life before your cancer diagnosis? Was it great? Not so much? Many women tell me that sex wasn't so great before their diagnosis, and now it's so much work that it hardly seems worth it. And many men, especially those with prostate cancer, have real challenges with function and feeling in their genitals. So either way, it can feel like another betrayal of the body when the sexual function doesn't work the way it did before. So we're going to bring that out of the shadows in this talk and talk about what's really going on so that you will know that you're not alone and you're not broken. There's so much possible no matter where you are on the spectrum of pleasure, intimacy, and sexuality. We're going to define and explore pleasure so that you have tools to create a personal pleasure plan for yourself. We're going to also redefine sex so that you have an entire universe of possibilities and perhaps better intimacy and sex than you thought was possible. So this is going to be lively, fun, deep, and inspiring, and you'll leave with some tools that you can begin to use immediately to enhance or recreate your intimate and sexual life. So I want to tell you a little bit more about me and why I know about this. As Sarah mentioned, I am a longtime cancer survivor. I was diagnosed on my 37th birthday, and then the roller coaster began, and I experienced a lot of self-esteem and body image issues. I was young and single and now knew for sure I was damaged goods and my sex life was over. But you know what? I wasn't willing to throw in the towel, but I knew I needed to heal and I needed resources. And back then there weren't any resources 28 years ago. So I had to research and adapt what I found. Over the course of those years, I created what I needed, and I shared it with many, many friends going through cancer. I met a man during treatment. We married and had a baby who's now 24 years old, and that's a complete miracle, having a baby after cancer treatment. I became a sex educator because this topic is so important. And since I'm also a long-term survivor, I know about this journey and how wild a ride it can be. So getting a diagnosis of cancer is like Mr. Toad's Wild Ride, honestly, and you know that as you have had your own experience or as you talk with patients. The thing is that lots of patients are surprised by the impact of cancer treatments on intimacy and sexuality because they may not know that's coming. So what have you experienced? Take a moment now and reflect on that. Some tell me that sex now is so painful that they'd rather stick a needle in their eye than have sex with their partner. What about you? Do you have a wonderful sex life? Do you want to have a wonderful sex life? Is sex a distant memory? The Livestrong Foundation did a poll several years ago on the top 3 survivor issues for cancer, and this is for all cancers, all patients that are over 18. And those top 3 survivor issues are fatigue, chemo brain, and sexual difficulties. And the sexual difficulties often continue to exist long after treatment has ended. But I happen to think all 3 of those issues are connected. So here are some things that are wild and unexpected. The impact on intimacy and sexuality. For women, depending on the treatment, especially if chemotherapy is involved, it can throw you instantly into menopause. So that is something that a lot of women don't know is going to happen. And many women with gynecological cancers may have some idea that it'll happen. Lots of women with breast cancer don't necessarily know that. And whether you know it or not, it's sudden and it's intense. And lots of women tell me that they feel like they aged 20 years in 6 months. And if you had a gynecologic cancer, did you experience the radiation tampon inserted into your vagina? I mean, just saying those words makes me want to shrivel up inside. It's a terrible, terrible thing. Well, what happens physically with menopause is cessation of menstruation and tissue and skin changes. So tissue, both internal and externally on the vulva and the perineum, can become friable, dry, tender. It shrinks, and there's a tightening up in the vagina as the mucosa dries up. Libido can drop or disappear, and painful insertion or penetrative sex can occur as a result of that. And for men, there's often erectile difficulties, particularly those who've had prostate or testicular surgeries, as well as colorectal surgeries. So what happens is there's often peripheral nerve damage. And when that happens, the penis doesn't get its typical 4 to 6 daily erections, and the blood doesn't flow in and out of the caverns inside the penis. And it can take 2 to 3 years for that peripheral nerve damage to heal. And it's critically important to manually create erections during that time, because if too much time passes, scar tissue can form and the caverns can atrophy, and then natural erections become impossible. Fertility issues. With gynecologic and genital cancers, it's imperative to know in advance of treatments what the impact on fertility might be. If there's surgical removal of ovaries, for example, it's important to know that there are procedures to harvest eggs and embryos and preserve embryos. It's costly and it's not covered by insurance in most cases, but it can be done. You may have to do your family planning far in advance of thinking you need to or are ready for it, but that's far, far better than not knowing and having these options disappear, because then it's too late after treatment. Radiation can damage ovaries and eggs if they're not removed surgically. I mean, it literally fries them and makes them unviable. So same thing, talk with your healthcare providers in advance of treatment. In some cases, depending on the woman and the drugs they're given, primarily chemo and hormonal therapies, menopause may be permanent or temporary. And even if we think it'll be temporary, your body may respond differently. So it's really worth it to talk to your healthcare provider in advance of treatment. And that said, there's lots of stories of successful pregnancies, and much more is developing in this area. The point is pre-planning. Okay, so let's talk about the emotional diagnosis impact. So fear, am I going to die? What will happen to me and my loved ones? Confusion, how did this happen? Why me? Anger, I've been doing everything right, I don't deserve this. Anxiety, feeling nervous, stressed out, overwhelmed, and pressure to make big decisions fast, not knowing the outcomes or long-range consequences of those decisions, and then grief mixed in with all of that. So there's a whole range on this roller coaster of emotions just with diagnosis. And then there's more emotional impact during and after treatment. So depression is very common. It's natural, and pharmaceuticals are not always the best treatment of choice because many of them suppress sexual response and sensation, even though that's often the first line that a doctor will recommend. It may not always be the best one. Then again, there's our friend fear. Will I make it through this? How will it change me? Will I ever feel normal again? What's going to happen? And then there's role confusion. So the caregiver in the family may now be the patient, and the breadwinner may now also be the caregiver, or the breadwinner may be the patient. That is very confusing for people, especially in couples and families. And of course, there's the betrayal of the body, especially if you didn't have symptoms beforehand, which is the case with lots and lots of people. They could think, I didn't have any symptoms. I could always count on my body to be healthy and strong before. And when we can't count on our bodies anymore, that's a hard one to deal with. Anger, treatment is way worse than what I was experiencing before. And I've lost body function. I've lost fertility. I aged 20 years in 6 months. I have a friend who just finished treatment for stage 3 lung cancer, and now he's dealing with peripheral neuropathy in his hands and feet. And he's really angry about that and not knowing if it's going to be temporary or permanent. And then there's also mixed in with that, there's hope. Hope that this treatment will cure me. Hope that I'll be around to live a good long life, that this is an opening into something new. And there's lots and lots of questions that come along with this too, like, am I still a woman? Am I still a man? Especially if the treatments have affected our sexual organs. Am I still desirable? This can bring up lots and lots of relationship issues. I work with many people where the cancer either blows them apart or in some cases brings them closer together, but it rarely stays the same. And then dealing with missing body parts. How do you deal with that? What about all those feelings related to that? Same thing with chemotherapy and radiation, and will I die from this? Cancer is a scary disease. A lot of people live with it, and a lot of people die from it, and there's a lot of fear associated with it. For you personally, how did you deal with the trauma of diagnosis, the trauma of treatment? On top of everything else that was going on, did you have the skills, or do you now have the skills, to cope with changes to your intimate and sexual life? Have you been able to share your story and feel heard? And sex now, well, let's talk about that. What's it like for you? Are you able to be sexual? Are you interested in being sexual? And what are the resources that you have? Who do you talk to, and what are your options? I mean, one of the things that happens with a lot of people is when the treatment involves therapies to suppress hormones, that has a lot to do with our libido and our desire to be sexual. It's not the whole story, but it has a lot to do with it. And I talk to lots and lots of people who say, I really want to, but I don't care very much. And I'm not thrilled with how my body looks and feels right now, so I'd rather just not even talk about that. So it becomes the elephant in the room. And because of that, there's some inner work for each of us to do. It all begins with your relationship with yourself. Whether you're single or partnered, you are your lifelong partner, the only one who's been with you from the beginning and will be with you until the end of your life. So it's worth it to explore and strengthen your primary relationship with you. And then there's feeling attractive and sexy again. This may seem impossible, especially with women who've had mastectomies or breast surgeries and reconstruction. It's really challenging for them. I talk with lots of women who can't even look at themselves, and they won't allow their partners to see them without clothing on. But there's lots to do here that will help. It begins with accepting and loving you as you are now. And most of us, especially women, think critically about ourselves, including before cancer. So even the most beautiful supermodels, you probably already know this, but they judge themselves really harshly. We live in a culture that has a narrow vision of what beauty is. And thankfully, that's beginning to change a little bit, but it still lives very strongly inside us. So when our breasts are affected or our sexuality is affected, we don't feel beautiful or sexy anymore. And most men measure their masculinity by their sexual abilities and they can not only feel emasculated, but that their partner won't want them anymore if they can't get erections. But there is hope. So these are some things that can help right now. Pelvic floor therapies to strengthen muscles, because our experience of orgasm has a lot to do with muscle contractions in our pelvic floor muscles, and they often get weak during treatment. Then there's the vaginal renewal program and the penile renewal program. I am so happy I found these programs, and I'm going to talk about them more thoroughly in a few minutes. Then there's education about intimacy and sex, learning about our anatomy, learning about what sex might really be beyond penetration, and communication. Hormones, if they're tolerated, and in many cases they're not. And then it's important to experiment and practice with what you're learning. So I like to think of this as scientific research. So you keep what works and get rid of what doesn't. And for me personally, over all these years, with all the tools that I've developed to give to people, I've had to try all this stuff out to make sure it works. And lucky me, I mean, I feel like I have the best job on the planet. So these are all longer-term strategies and interventions. But what about right now? So I just want to say that even though this image shows a man and a woman, with these tools I'm giving are for everyone, no matter what your sexual orientation or preference is. I don't intend to make this binary. I just think this is a beautiful image of kissing. So for what to do right now, I'm going to give you some power tools, because after all, that's what we're here for. So here we go. Immediate tips. First, take penetration, intercourse, and orgasm off the table. Why do I say that? I say that because we want to shift the focus. Usually we're taught that what sex is penetration and some fluid exchange and an orgasm, and that's it. And I had a conversation with a colleague of mine, Marty Klein, who wrote a book called Sexual Intelligence, which is a great book. And what we talked about is that we put so much pressure on ourselves to perform that we miss what's happening along the way. And when you stop and think about the scheme of what happens over the time of, first of all, thinking that you might be sexual with your partner and making a date and flirting and then starting to play with each other and having foreplay, to kissing, to taking your clothes off, to actually having some penetration and an orgasm, that part of the penetration and the orgasm is usually less than 5 minutes. And that's what we put our focus on, but all the rest of it can be hours, both before and after. So because we're so conditioned to think that orgasm is what sex is all about, we pressure ourselves to do it maybe before we're ready after treatment, and it can rapidly become a downward spiral. And if it's physically painful, which it is for lots of us after treatments, things can rapidly go downhill really fast. So just take it off the table. It doesn't mean permanently, although it might, if depending on what your current situation is, but at least temporarily. And give yourself some time and space. And then be patient and keep a sense of humor. Slow down. This is not a race. As I said, most of us are so focused on the orgasm at the end that we get very serious and we miss the journey, like how great the kissing is, for example. And then remember that communication is the best lubrication. Now, I know that the webinar last month was about relationships, and I'm sure that communication was covered in there. From this perspective, when we talk about our intimate and sexual lives, take a moment and think about, where did you learn about your anatomy and sex? Who taught you? And was it good information? And how could you know then whether it was good information or not? Usually the sex education that we get happens when we're teenagers. It's usually very limited and related to preventing pregnancy and diseases and how to have safe sex. Well, what about pleasure and love and knowing when and what to do? And do you even have the language to talk about this? Most of us are sorely lacking in this. So just right now, take a moment and think back about your personal sexual history. And here's a few questions to help you think about that. What was your first sexual experience, however you define that? If you've had intercourse, what happened the first time you had intercourse, and who was it with? And what's your experience with self-exploration and pleasure and masturbation? And have you had any same-sex experiences? Or if that's your preference, what's that like? And what are the significant sexual experiences that you've had? For example, your first masturbation, your first orgasm, your first menstruation, pregnancy, abortion or miscarriage, or if you've experienced abuse or being molested. And then what about your most joyful sexual experiences? What have they been? And as you think back on that, listen to your story, because you're reviewing your sexual story, your history. What is your story? And then if you have a partner, it's really valuable to take some time and share your sexual histories with each other in this context, and understand that these are things that you may never have spoken before, and it can feel risky and tender, and it's also very intimate. And part of the reason that I encourage sharing your sexual history is because it's a great way to start to learn the words, to develop your vocabulary, to make it more comfortable to talk about sex. It's a taboo in lots of ways in our culture, and it's become kind of polarized right now. Either we don't talk about it or we talk about it too much, and there's so much pornographic information available online these days that we can get lost in all of that. So to simply sit with our partner and have a conversation about this can be a really wonderful thing to do. And also, when you're doing it, having that conversation, what is it that you want to know about sex? Because there's a whole lot that we don't even know we don't know. Okay, so let's talk about arousal and libido and what to do. First of all, it's important to understand the arousal cycle. So just in a nutshell, during the arousal cycle, what happens is our nerves send information to the brain about the sensations we're experiencing. And the brain, after interpreting the information as pleasurable, responds by sending messages that cause increased blood flow to different parts of the body. And this increased blood flow typically results in engorgement or swelling of the genitals, erection of the clitoris or penis, flushed skin, and vaginal or penile lubrication. With adequate stimulation and time, and by time, it can take 20 to 45 minutes of direct clitoral stimulation for women. A woman typically can become aroused enough to have an orgasm. It typically takes much less time for men, and many men feel that their arousal cycle is too short and call it premature ejaculation. But it's not really that. It's simply a difference in timing. So it's important, if you're in a heterosexual relationship, to take that into consideration and plan around that. Then, when orgasm occurs, the brain sends the message for the pelvic floor muscles to rhythmically contract, which can last about 10 to 15 seconds. This is a reflexive response similar to a sneeze. And for most of us, it's perceived as intensely pleasurable experience. So eventually the brain says, okay, done. And then all the muscles in the body relax, and gradually the physical signs of arousal subside, and the feelings of well-being and whole body relaxation set in. So all of that can get really out of whack with cancer treatments. We can feel afraid, desensitized, incapable, angry, scared, and confused. Surgeries, radiation, chemo, and hormonal therapies all can interrupt the arousal cycle in different ways and cause the physical side effects that we talked about. Our nerves can be damaged by treatment, by pain, or by numbness. And if your libido's gone, hormones are not the whole story, but now it takes a commitment and an intention to change this. But I have to say, there is hope. That's the good news here. So what if we were to take the word sex and change the definition, where most of us define sex as penetration, orgasm, and fluid exchange in some form or another? What if we took the letter sex as an acronym, and then sex became sensual energy exchange, or sacred energy exchange, or spiritual energy exchange, or slow energy exchange? Well, what the heck do I mean by that? So let me just give you an example. And while I'm doing this, just imagine yourself going through this process. So imagine that you're sitting with your partner on the couch, gazing into each other's eyes and not speaking. Just let the words fall away. And maybe you're playing some soft background music. You're just there with each other, and you're taking some deep breaths together as you gaze into each other's eyes. You may know the adage, the eyes are the windows to the soul. So as you look into your partner's eyes, what do you see? And what do you think they see when they're gazing into your eyes? Can you simply see and be seen? That doesn't always feel easy for a lot of us because we don't have a lot of experience with it. But as you continue to sit and breathe and gaze into each other's eyes, notice as your heart and your body gradually relax and open. There's nowhere to go, nowhere else to be, just you and your sweetie. And then one of you gently reach your hands out and ask your partner if you can stroke their face, and then gently begin to stroke their face, just one at a time. And as you're stroking, be curious as you explore their skin and the contours and the textures and the difference between their eyebrows and their lips, for example. And as you're doing this, through curiosity and with love, see how perfect and beautiful they are, just as they are. And then after a minute or so of doing that, then you switch. So that if you started stroking, now you let your hands come to your lap, and your partner gently reaches out and asks permission and then strokes your face in the same way. Just for a couple minutes, all without words other than asking for permission. Then when you've both had a turn, giving and receiving the touch, let your hands gently rest in your lap and continue looking into each other's eyes, taking some deep breaths, and then take a few minutes and share what you experienced. Did you like it? Did you hate it? Was it awkward? Was it easier to give or to receive, or did that feel about the same? And how are you feeling right now? So that simple exercise takes maybe 10 minutes, but it makes a big, big difference. People report that they feel seen, loved, connected, relaxed, intimate, that there was an energetic exchange that has it feel very intimate. And that's what we all crave. And a lot of times we don't know how to get that kind of intimacy, so we attempt to have sex because that's what we've learned. But stop and think about this kind of energy exchange. Was that sensual? Was it slow? Was it intimate? And by the expanded definition, you just had sex. So what this does is this opens up an entire new universe of possibilities for intimacy and touch and coming back together. So one of the things that I've noticed with a lot of people during treatment, when we're just getting through treatment, sex may be the last thing on our mind, and our partner doesn't want to hurt us. And what happens is we stop touching each other. And then, depending on how long treatment lasts and how you're feeling and what's happening in life, 6 months, maybe 12 months goes by, and you haven't touched each other, and it's like a gap has opened between you that may feel like the Grand Canyon. And if your idea of sex is that it involves penetration, and penetration you're afraid of now because it might be painful, it's like the Grand Canyon. So using this definition of sex and slowing things down and creating intimacy is a really great way to build bridges back into intimacy. It's a very powerful thing. Then, while you're doing things like that, if you have experienced vaginal atrophy or pain or erectile challenges as a result of treatment, there are 2 wonderful programs that really work to help recover vaginal health and penile function and pleasure. So I'm going to talk about these programs. This is the Vaginal Renewal Program and the Penile Renewal Program. And honestly, I feel like I could be the poster girl for the Vaginal Renewal Program, because when I came across this program, both of these programs were developed by an organization called Sexuality Resources. And I'm going to give you their website at the end so you can find this information. Anyway, it had been 7 years since I'd been sexual, and I didn't know that anything was going to work anymore. And I was terrified. And I met a man and fell in love, and I did this program for 6 weeks. And we were, dating and kissing and, that kind of stuff. And within 6 weeks, I was able to have penetration without pain. Well, hallelujah. So I sing the praises of these programs, and I teach them whenever I can. So the vaginal renewal program is the key to the queendom, as far as I'm concerned. So the name of the game with sexual arousal and sexual function is largely about blood flow. And when our hormones get suppressed or our nerves get damaged, the blood doesn't flow in the same way. So the vaginal renewal program helps to promote blood flow back into the vulva and the vagina and internal parts. It encourages skin flexibility and thickness. So one of the things that can happen is that our tissues can get really thin and they tear very easily, and that can make penetration painful. So this can enable pain-free penetration. It soothes vaginal dryness, and you can recover vaginal health without hormones, because many of us who've had breast cancer we can't take hormonal therapy anymore. So that's all the things that are possible with this program. And here's some how-to. So I'm going to just go through this very briefly, and then I said I'll give you a source so you can get more information about this. So when a woman experiences menopause, the decrease in estrogen can cause lots of symptoms, including thinning of the skin of the vulva and the vagina, and or a decrease in vaginal lubrication. And this can, as well as the decreased blood flow I talked about. So this may result in discomfort or pain with touch or penetration, whether it's in a sexual context or even during a gynecological exam. So having these symptoms that make contact difficult or uncomfortable or painful can make you feel like your sex life is over. But this is something that can actually help here. So comfortable vaginal penetration depends on the flexibility of two different structures, the skin and the pelvic floor muscles. And the vaginal renewal program, as I said, helps to recondition the health and flexibility. Some women, when they do the vaginal renewal program, still experience uncomfortable penetration because their pelvic floor muscles are inflexible. So if that's the case with you, it's important to see someone who can help assess what's going on with your pelvic floor, because there's lots of different things that can happen, and there are specialists who can help. Okay, so the vaginal renewal program, it's a 3-part program. So the first part is to choose a moisturizing personal lubricant. Now, lubricants, I'm going to talk about a little bit further on too, but lubricants are designed for many different purposes. There are hundreds and hundreds of lubricants available, and you want to make sure as a moisturizing lubricant that there are water-based ingredients, and you want to avoid glycerin and mineral oil, olive oil, jojoba oil, beeswax, paraffin, petroleum, and low-quality silicone, because they can all cause problems. And it's also really important to avoid replens, even though many, many healthcare providers recommend it. I'm going to tell you some of the ingredients in here. So it contains glycerin, which is a drying agent, and it can also injure the kidneys at high concentrations, according to OSHA. Mineral oil, which clogs your pores, polycarbophyll, and carbomer 934P, and carbomer 934P is manufactured using benzene. Then hydrogenated palm oil, glyceride, sorbic acid, methylparaben, and sodium hydroxide. Methylparaben has suspected estrogenic effects, and sodium hydroxide is another term for lye. We don't want to put that stuff in our vagina. So even though your healthcare provider might prescribe it, please do not use it. So when I talk later about lubricants, I'm going to recommend a few that I really like. So the first step to the vaginal renewal program is to take your moisturizing lubricant and spread it all over the vulva and the perineum and the upper inner thighs. You just want to be generous with it and slather it all over. And then you want to take your dominant hand and make a loose fist with your hand, and then take your thumb and press it against your bent index finger. And you want to do that motion all around that external tissue. So you're squeezing it so that if you're light-skinned, the tissue is turning pink. And if you're darker skinned, you probably won't see that pink, but you want to be able to feel it so that it tingles. You don't want to pinch so hard that you hurt yourself. But that pinkness or that tingling is telling you that the blood is beginning to flow through those tissues. So that's the first part. And then the next part is to get, and you can get this at the pharmacy. It's a little applicator, like a syringe type applicator. Fill that with that same moisturizing lubricant and then insert that into the vaginal opening. And then there are different sized vibrating wands that you can also get through Sexuality Resources. You coat the vibrating wand with the moisturizing lubricant, insert it into the vagina, turn it on to medium. It has slow, medium, and high speeds. Try medium first to see how that feels, and let it run for about 5 minutes. So that's doing internal massage. You can do the massage manually, but it's easier to reach all the spots using that wand. And this is not intended to get you turned on or excited, but if it feels good, great, so much the better. So what many women do is the wands come in 3 different sizes, and depending on your condition, you might start with the smallest wand, which is about the size of my index finger, a little bit more in diameter than that. And when you can comfortably insert that wand and your index finger alongside it, and it feels fine, then that's when you move up to the next larger size one, and so on until you're using the largest one. So depending on your condition, that may take 4 weeks, it may take 6 weeks, it may take 8 weeks. I recommend that you do this daily. It takes about 10 minutes a day. And if you have a partner, it's a very intimate thing to do with your partner. So that's the vaginal renewal program, and it works. And for women who've had gynecologic cancers and have scarring, vaginal scarring, for example, what the vibration does is it helps to break up that the scar tissue, and new tissue can form underneath it, and it will slough off the old dead skin. And then what can happen is that new tissue over time doing this vaginal renewal program can actually mimic some of the effects of estrogen in terms of your ability to self-lubricate. So that works to varying degrees for some women, but there's plenty of lubricants that you can use to help. So that's the vaginal renewal program. Then the penile renewal program is intended to, again, this is also created by Sexuality Resources, is to help men take important steps towards improving, maintaining, and recovering erectile function when they understand how the penis works and what techniques improve function. It also helps to increase the daily oxygen exchange to the penis, which is important for blood flow, and then to maintain the length and the girth of the penis so that the erection size and hardness may be possible once those nerves have recovered. And as I mentioned earlier, those nerves can take up to 3 years to recover. Now, if you have had serious erectile function issues before your treatments, you probably will not go far beyond that in terms of recovering your function, but you can still have lots and lots of pleasure. So erections are dependent on a couple of things. Physical structures. So there's a clitoral body inside the penis that's a fiber-like flexible shell on the outside, and it stretches during erection. Then there are small curled blood vessels that occasionally open to let oxygenated blood in, and stretchy sacs that hold blood during an erection. It's the stretch, the tension, and the blood flow that makes a penis hard and erect. All these parts have to be healthy, flexible, and free from inflammation or scarring to create a firm erection. Then there's a special biochemistry that happens, which is those small curled blood vessels in the clitoral body relax in response to a chemical called nitric acid, which allows blood to flow into the penis or the walls of the clitoral blood vessels when they're stretched and massaged. And then it also depends on low overall body inflammation. Nitric acid is a special chemical, and it doesn't work when we eat junk food. Really, it doesn't. And it doesn't work if we don't get daily exercise. For that reason, eating a healthy diet and walking every day supports sexual arousal, because a healthy lifestyle helps nitric acid to do its work. Damaged, stretched, or cut nerves deep in the pelvis are common during surgery or radiation for prostate, colon, or rectal cancer. It's common for men with prostate cancer to have pre-surgical erectile difficulties, and men who have trouble getting erections before surgery will have more difficulty recovering after surgery. So this is a double whammy. Erectile trouble before surgery adds to the disturbance of prostate surgery, and it makes it harder to recover function after surgery. Stretched nerves during surgery can become stunned, and they can't function until they recover. When the nerves stop working, then oxygen-rich blood will stop flowing into the clitoral body inside the penis, and scarring can occur. So it's important to keep the blood flowing to the nerves, the small blood vessels in the clitoral body, so that the oxygen exchange can still happen and will hopefully work when the nerve function recovers. It's hard to tell when the nerve recovery will occur, so it's worth it to facilitate blood flow to the penis for the entire 3 years after surgery. And it feels good. So fortunately, the techniques here will improve that blood flow to the penis even when the nerves can't do the work. So here's the how-tos, and I'm just going to buzz through this, and then, as I said, I'm going to give you a source where you can find more information about this. So it starts with a nightly dose of a PDE5-1 medication if your health condition allows and it's cleared by your healthcare provider. So that means Viagra or Levitra or Cialis. And you need a prescription for that, so you need to talk with your healthcare provider about it. Then gentle stretching and massage of the penis, and then using a vacuum erection device 2 times a day, and then pelvic floor muscle exercise. So in this source I'm going to give you at the end, you can download a brochure on the vaginal renewal program and the penile rehabilitation program from the Sexuality resources site. These are wonderful, wonderful programs. I'm very happy to talk about that. So these are good things to do because they take time while you're doing the sacred energy exchange, while you're doing the slow energy exchange, while you're exploring other ways to be intimate. All right, so I said I'd talk about lubricants a little more. So as I said, there are hundreds, and they're formulated for different purposes, and it's really important to read the labels. So if there are a lot of ingredients in one that you can't pronounce, it may be best to stay away from that. I'm a big advocate of natural or organic products because oftentimes, especially for women, our vaginal cavities are tender and delicate, and we don't want to cause more problems. It's also important to try samples. Many shops that sell lubricants have little packets of samples, and they're great to take home and try because, you know, the bottles are expensive, and so it's good to find things out. Because sometimes, even with one that's all organic, if it has some kind of essential oils in it, you might be sensitive to particular essential oils, and that may cause a skin reaction. So you want to avoid glycerin, as I said before, any petroleum products, parabens, and mineral oil. And you also, I don't recommend that you use coconut oil or olive oil. I know lots of people like those, but those products in my mind are made for cooking, not for internal use. And so I think it's best to find a lubricant that's formulated for sexual and intimate play. There are also lubricants that are silicone-based, which is not an all-natural ingredient, but there are some that have high-grade silicone in them. And the reason for using a silicone-based lubricant is because they reduce friction. They don't moisturize, but they reduce friction. So one of the things that I often do is I layer my lubes. So I'll put my moisturizing lube on first, and then if I'm going to have some kind of penetration or use a vibrator or have a toy inside, then I will put the silicone lubricant over the top of the moisturizing lubricant. And what the silicone lube does is it holds the moisture in and lets it go into the skin, and it reduces friction. So there's a little tip for you, a lubricant cocktail. So some of my favorite lubricants include, there's a company called Sliquid. They make one that's called Organics Botanically Infused. It's a water-based lubricant. It's very nice. Liquid Silk is another one, and that has silicone in it. And then there's another company called Good Clean Love, and one of their products is called Almost Naked, and I like that one as well. So as I said, it's a good idea to go into a store and read the labels and get a few samples and take them home and try them. And on my website, you can dig around. There's an article I wrote several years ago on how to choose a lubricant that has more steps involved with it, which is kind of good. Okay, so let's talk about pleasure planning. While you're doing the vaginal renewal program or the penile renewal program or both, and you have penetration and orgasm off the table, here's some ideas to help build bridges back to intimacy and have some fun. So first, a weekly date with your partner, if you have a partner, with yourself, if you're single. And the idea on the weekly date is no agenda other than being together or with yourself and having it be pleasurable. So it's not necessarily about sex. It certainly shouldn't be about orgasm or penetration, but it's really about pleasure and just connecting in that way. And while you're doing that, then think about sensate focus. Sensate focus is a term for returning to embodiment. Lots of people dissociate during treatment as a coping mechanism, and then they don't know they've done that. So sensate focus is all about the physical senses: touch, taste, smell, hearing, and sight. And it's great to focus on your senses. So you could start with maybe a chocolate tasting if you like chocolate, or preparing a beautiful and tasty meal and serving it on a table that's set with candles and flowers. So to just get your senses involved, that helps you come back into your body. And then getting to know your body now, and by that I mean your entire body, what feels good and where. So where in your body and what types of touch, because things really change. As you may have nerve damage, you may have neuropathy, you may have parts that aren't there anymore. So I like to think of it as learning to play an instrument. Like, I took piano lessons when I was younger, and what it was learning how to read music, how to play the notes, how to play scales, how to make chords, and then practice, and learning how to play solos before duets. So as you get to know yourself, it's really important to learn your body as it is now. Where are the places that it feels really good to be touched, and what kind of touch feels good there, and what brings you pleasure, and to play yourself first as a solo before you try to do it with your partner as a duet, because duets are way more complicated to play than solos. And then using that information, make a pleasure map. So you can do this either on your own or with a partner or both. And what you do is, as you're getting to know your body, you draw an outline of a human body on a piece of paper, and then make, using magic markers or colored pencils or crayons, you make marks on the body on different places where you know it feels good and what kind of touch you like. So for example, on your inner thigh, you might really like to have a circular massage there with your thumb. So then you would, on your pleasure map on the inner thigh, using whatever color you like to indicate what kind of pressure you like, make little circles to show, oh, that's the circular motion. Or you might make little parallel lines, 4 little parallel lines up the arm, which means that, oh, I like to have my inner arm lightly scratched with fingernails. So you get the idea. So it's to explore and make notes so that you can remember them, and then you can either share the map you've made of yourself with your partner, or once you know that, then you and your partner can explore, because it's a whole different experience the way someone else touches you than the way you touch yourself. And the point is to commit to your pleasure, because you are worth it and you deserve to have pleasure. So how do you put all this together? Well, you start with, what is your vision for intimacy and sexuality for yourself and as a couple, if you're part of a couple? It's a new game now, so it's worth exploring your desires and needs. And then think about the tools that you have at your disposal. So I've given you some tools here today, and then think about what other resources you have. What are some daily practices that you can do that increase your pleasure and what feels good to you? And then set a weekly or monthly goal for yourself and give yourself a reward when you hit your goal, and then revisit that every 4 to 6 months. So sometime in the next couple of days, take a pen and paper, and sit down and close your eyes and let yourself imagine what you'd like in your intimate and sexual life. Let your imagination go, and then also feel what it feels like to have what you want. What are the feelings that you feel, and what are the experiences that you imagined? And then open your eyes and write down what you just imagined and felt. And then evaluate the tools that you have. Perhaps you want to take orgasm off the table for now. You're communicating with your partner if you have one, or with you via journal or with friends. You have redefined sex. You know what brings you pleasure. Begin to think about what might feel sexy to you. Maybe it's to define what sexy is. What will you do each day? And then where do you want to be in a month? And how are you going to reward yourself? So if you're hearing this and thinking about it, write down what appeals to you. And then take those notes and organize them into a personal pleasure plan. And then you'll be on your way. So a few more resources, books. Sarah mentioned I wrote a book called Sexy After Cancer. There's a woman named Ann Katz who has written two books, one called Woman Cancer Sex and one called Man Cancer Sex. Pelvic floor therapy, as I mentioned before. Sexualityresources.com. That's where you can find the vaginal renewal and penile rehabilitation program brochures, along with lots of other great educational resources. And they also sell lubricants and devices. I work with people privately, and I also hold workshops. And on my website, which is sexyaftercancer.com, I write the Sexy Saturdays blog. So there's lots of information there. So we have a few minutes for questions. So if you have a question, please write it in the chat box, and we'll take a few minutes and answer any of your questions.
Barbara, I have a quick question here.
Sarah?
Do you have anything to say about like therapies like Thermiva or FemLift or any of those about to deal with vaginal atrophy?
Yeah, there's a new one. There are several that they're laser based, and the theory behind them is that they break up that atrophied tissue and then let new tissue grow. So that's the idea behind them. I have talked to a few women who have experienced it, and they said it helps some, but in some cases it doesn't last longer than 6 months or so. It's expensive and it's not covered by insurance. So for me, I tend to prefer the tried and true approach, like something like the vaginal renewal program, which may take a little longer, but it doesn't cost as much, and you'll get good results with that.
Okay.
There's also a device I got recently, and I call it the growler because it makes a little growling noise. It's called the sensual something I got at Amazon, and it has a little suction thing. It fits over your clitoris, and you turn it on, and it pumps tiny little puffs of air onto your clitoris, and you can control the speed and the intensity of those little puffs, and it's designed to stimulate your clitoris, and that's very pleasurable because a lot of women experience orgasms through clitoral stimulation. So that's a nice little device to use. And it's great if you're going to have sex with a partner to use that before, so you get yourself all warmed up and ready to go.
Another question here. You talked a lot about lubricants, and when you say go to the store and get samples, and what kind of store are you talking about? Are you talking about your neighborhood Walgreens?
Sometimes they have samples, but most cities and towns have stores that sell sex toys and sex supplies. I mean, here in the San Francisco Bay Area where I am, there's a whole chain called Good Vibrations. And you can go into a store like that where they sell devices, and they all have samples. And it might cost 50 cents to get a packet. You can also get sample size of lubricants from Sexuality Resources. They have some samples available too. I don't know if Walgreens does or not.
So are the lubricants that are available in the Walgreens, are those ones that we should avoid necessarily?
Well, not necessarily. I mean, they usually sell pretty basic ones. One that I would stay away from is Astroglide. Astroglide is in many, many pharmacies, and Astroglide was originally formulated for gay men for anal penetrative sex, and that may not be the best formulation for vaginal penetration. But there's also some lubes called the Good Clean Love is around and readily available. That's in all those pharmacies, and they even sell that one in grocery stores. There's another one that I've just received some samples of called Aloe Cadabra, and that's like 95% aloe. So that's supposed to be quite soothing too. But again, it's important to read the labels wherever you go, as I said.
Right.
Any other questions? How about you, Sarah? Any more showing up for you?
No, I don't see any more. So certainly chime in if you have any more, but with that, I'm going to just advance the slide. Oh, go ahead.
Okay. I've got one more slide here. So if there's no more questions, I just want to read you this quote, which I love. It's begin what you want to do now. We're not living in eternity. We never know how much time we have left. We have only this moment, sparkling like a star in our hand and melting like a snowflake. So just do something. Take steps and get yourself going, and that'll point you in the right direction. So thank you all so much for being here, and if I can provide other resources for you, please let me know. Okay, Sarah, back to you.
Okay. All right. Thank you so much, Barbara. That was wonderful. Okay. While if you have any more questions, again, chime in here. But while we're waiting, I'm going to go over some remind you about the CEUs. So I'm going to, right after this, direct you to an evaluation that you have 1 week to fill out if you want to get your CEUs. And again, include your email and the phone number you were dialed in on if you were using a phone number. And if you have additional feedback, we would really appreciate that as well. So be honest on those evaluations. We want to improve and give you guys the information that you are really seeking, okay? So this is all of our contact information. And with that, I'm going to say goodbye to all of you. Goodbye, Barbara. Thank you very much.
My pleasure.